Welcome to our webinar titled Ask an Expert, a Q&A with an Oncology Dietitian. Thank you for joining us. My name is Lee Clark, patient educator, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generous support of all of our corporate sponsors and the generous support of patients, families, and caregivers for supporting the webinar program today. Due to the high volume of teleconferences on the internet, it is possible that you may lose your connection during the program. If you are unable to view the program online, you can call in to hear the audio portion of the program using the call-in number in your reminder email. Today's program will be archived to our website within 2 to 3 business days. You will be notified by email when it is live and ready for viewing. Immediately following the presentation, there will be a question and answer session. Please feel free to submit your questions at any time during the presentation. To submit a question or comment, open the Q&A window in the lower part of your screen. Type in your question or comment in the small text box window. And when you have finished typing, just hit enter. We'll do our best to get to everyone's questions today. When asking questions, I do ask that you do 2 things to help me manage the incoming question. First, submit your entire question all at the same time. Second, please do not share private health information in your question. Our speaker cannot answer any specific questions related to your personal health care. Today's specialist is Joanna Myers Casale. She is a registered dietitian who serves as an oncology dietitian at MD Anderson Cancer Center, Cooper in New Jersey. Joanna, welcome. Thank you for joining us today.
Thank you, Lee. Hi, everyone. I hope you are all doing well. Let me just pull up my slide. Does that look okay?
Looks great.
Okay, perfect. All right. So I am here to answer, to the best of my abilities, any questions you have for me. But I wanted to start off our presentation by spending a few minutes going over the general recommendations for what a healthy diet should look like. And then the rest of our time, I'll be able to answer any questions you may have. So when it comes to eating a healthy diet, I think one of the best things we all can do to improve our health and to feel better is to try to focus on eating more plant foods. And by plant foods, that means eating more vegetables and fruits, but also whole grains, beans and legumes, and nuts and seeds. Time and time again, research shows that those who eat the highest amount of plant foods in their diet, that they have better health and that they are less likely to have chronic diseases, everything from cancer to heart disease to type 2 diabetes. And that is because these plant foods contain so many nutrients that are protective for all of the cells in our bodies. That is something like fiber, which is sort of the indigestible part of the plant food. That includes vitamins and minerals and nutrients that we call phytochemicals, which just means plant nutrients, but these are things like antioxidants. And all of these nutrients help to protect the cells in our body and reduce inflammation. So a good rule of thumb is to try to make about 75% of your plate plant foods. And again, that's your veggies, fruits, whole grains, and beans. I think an interesting fact is that people who live in the blue zones tend to eat about 95 to 100% of their plate plant-based. So if any of you haven't heard of the blue zones are what we call the parts of the world where people live the longest lives, where it's common for them to live to be 80 to 100 years old, and they also tend to maintain a lot of strength and stamina. And in the blue zones, there are much lower rates of heart disease, cancer, diabetes, and other chronic diseases. So we pretty consistently see that the more plant foods someone eats, the more longevity they have, and the less likely they are to have other chronic diseases. Another good rule of thumb is to try to focus on eating foods in their more natural state, which means fresh foods, foods that have been minimally processed. We know that these foods contain more nutrients than processed foods, and they also contain less preservatives, which some people can be really sensitive to, and preservatives can cause some inflammation and keep people from feeling their best. So foods that are in their whole state tend to be found around the perimeter of the grocery store. So shopping in the produce section, getting fresh cuts of meats and seafood, and being really careful in the center part of the grocery store, the aisles. And when I look at a label and I look at the ingredients, I try to stick with buying products that have ingredients that I can pronounce. There are a couple of foods we want to try to limit in our diet. So I really believe everything in moderation. But a good rule of thumb is to try to limit sugary drinks, so beverages that have been sweetened. That would include soda, sweetened tea, lemonade, and fruit drinks, and instead trying to focus on more unsweetened tea, seltzer, flavored water, or just regular water, coffee, and tea. And it's also good to limit sweet treats and baked goods. So again, everything in moderation. With the holidays, I want you to enjoy your favorite cookies and desserts, but trying to, in moving forward, make sure that's not something that you're consuming multiple times a day, every single day. I do find that sugar can be very addictive. So sort of the more of it that you're eating and drinking, the more your body wants it and craves it more. So if you are someone who feels like you maybe are consuming a little bit too much sugar in your diet, maybe starting in January, you could try eliminating it from your diet for about 1 month. And that can usually be enough time to really break that addiction and kind of start fresh and be able to have it just in moderation, but really control your craving. It's also a good idea to limit red meat and processed meat. So by red meat, from a cancer standpoint and a heart standpoint, that is beef, pork, veal, and lamb. And the guidelines are to limit this to about 18 ounces per week. And a deck of cards is about 3 ounces for some reference. So a little bit in your diet is perfectly safe, but consuming it every day, multiple meals a day, can get you over that 18 ounces where it starts to affect your heart health. And it's a good idea to try to avoid processed meats, which are your bacon, sausage, hot dogs, and deli meat. These meats tend to have nitrates and nitrites that we know increase your risk of heart disease and cancer. You can try to look for the nitrate-free versions and the uncured versions, and we think that those might be a little bit better for health. And then this image just depicts what your plate can look like if you are trying to make 75% of your plate plant-based. So you can see that on this plate, this person still has some chicken in their diet, but they're keeping it to about a quarter of their meal, and the rest of the meal are those plant-based foods. So they have some rice and beans, a little bit of salad, some steamed broccoli, and then some fruit on the side. And my favorite resource, if you are looking for more information on nutrition in bone marrow failure, I would encourage you to go to the website of the American Institute for Cancer Research, which is AICR.org. They just have a lot of information on what you can eat and how it affects your health, and everything is backed by research. They have something that I think will be great for the new year. They have a 30-day cancer prevention checklist where every day you set a goal and you check it off when you accomplish it. So it's something like walking 1 mile a day, replacing meat with beans or lentils for one of your dishes. So something fun to think about doing in January. So what questions do you have for me today?
There we go. Thank you so much, Joanna, for getting us started here. So we have some questions that are coming in. So our first question is suggestions for vegans, those who may be suffering from dry eyes or dry skin.
All right, so if you're having dry skin and dry eyes, something that could help is including more healthy fats in your diet. So that could include more avocados, more guacamole. Avocado is great on a salad, on a sandwich. You could include more nuts, so peanuts, almonds, pistachios, nut butter, such as peanut butter and almond butter, and more healthy oils. I use a lot of olive oil in my cooking or avocado oil. And for those who are not vegan, you could also incorporate some healthy fish oil. So having more salmon and tuna in your diet. And those, again, those healthy fats can help with dry eyes and dry skin.
What are your thoughts on the intermittent fasting for bone marrow failure patients?
Yeah, that's a great question. So intermittent fasting is very popular in the news these days. So intermittent fasting means that individuals go a period of time per day, usually, without eating anything. So a general, something that's common would be intermittent fasting for about 16 hours a day. So that means that you're only eating within an 8-hour window of time. So how many people incorporate that is by maybe skipping a breakfast, having a lunch, and then eating an earlier dinner. And then the rest of the day, they're just having something like water. So I am not aware of much research specific to bone marrow failure with intermittent fasting, but it is being studied in cancer. So there is research on breast cancer survivors and how that 8 to 16-hour window of fasting may be a little bit protective and just associated with good outcomes. They think maybe less likely to have cancer recurrence. There is just research on this with longevity. So again, living longer, healthier lives, and that 16-hour window seems to be protective. So at this time, no specific research that I'm aware of for bone marrow failure, but we do seem to think that it is protective for individuals to do that. And it's probably because that 16-hour window of time when we're not eating, it gives the cells of our body time to repair, which is just very protective. It can reduce inflammation and lower the risk of chronic diseases. The one time I would say someone should absolutely avoid intermittent fasting is in anyone who has a history of an eating disorder, because it's certainly a little bit of a triggering behavior for restriction.
Thank you. What is the best way to cook your vegetables?
Yeah, great question. So I think eating vegetables in any way, shape, and form is great for health. So certainly if one is on the neutropenic diet, they are limited and they're less likely to be able to enjoy raw vegetables like salads. So I know that's very common in our bone marrow failure population. So I would say, I think a variety of cooking preparation methods is good. So certain vegetables, I love the taste of them roasted. And that is in particular the cruciferous vegetables like broccoli and Brussels sprouts, where they can have a very strong taste and an odor. But when you roast them in the oven at that very high temperature, they caramelize a little bit and they taste a little bit sweeter. So I always recommend roasting vegetables, especially for people who think they don't like many vegetables when they're cooked. I find that they enjoy the taste of them roasted more. We know that steaming vegetables is a good quality preparation method. There is some concern with boiling vegetables unless you're making a soup, because when you're boiling it in water, the vegetables can lose some of the vitamins. And then if you're just draining the water down the sink, you lose some of that nutrients. So be careful with boiling. I think even sauteing and lightly frying vegetables is good. Of course, if you really enjoy like a deep fried vegetable, just do that in moderation. And for those who are not on a neutropenic diet and can continue to enjoy raw vegetables, I always like to remind people there's a little bit of a misconception that only raw vegetables are healthy and that vegetables lose a lot of their nutrients when they cook them. But that's a little bit of a misconception because sometimes when we cook vegetables, our body has an easier time absorbing some of the nutrients. So in general, a variety of cooking and preparation methods is good for health and just for variety and different tastes and flavors.
If fresh vegetables are not available, which is best, canned or frozen?
I would say frozen, absolutely. So the concern with canned vegetables is that very often they add a lot of salt to it to help with the flavor and with preserving it. But when you get frozen vegetables, they were picked at their prime, they were immediately frozen, and they maintain a lot of their vitamins and minerals. Frozen vegetables can actually sometimes even have more nutrients than fresh because from the moment you pick a fruit or a vegetable, all of that time that it's out, hanging out exposed to light and oxygen, it's slowly losing some of the vitamins and the nutrients. So frozen is great. Maybe just looking for the ones that don't have too much of a processed cream or a sauce added to it. So I just kind of stick with the plain frozen vegetables and I buy them every week at the grocery store.
This comes from a patient who says they are persistently low on magnesium. They've tried many supplements, but they've been causing some diarrhea. They're worried that maybe they can't absorb it. Are there any specific high magnesium foods that may be better absorbed and retained?
Sure, so that's a great question. So a magnesium deficiency can be common, especially in the oncology population. Some of the treatments that our patients receive can make it harder for them to maintain a good magnesium level. So it's common for our patients to need magnesium supplementation. Some patients need it through an IV, and some patients can take an oral form of a magnesium supplement. Certain forms of magnesium are certainly more likely to cause digestive issues and diarrhea. So if you do find that you need a magnesium supplement, reach out to your oncology hematology team and make sure that you're on the form that is less likely to cause those belly issues. Some forms are more likely to cause diarrhea, others are a little bit gentler on the intestines. It is hard to get a lot of magnesium in your diet. Our body does not absorb it very well from food, so you may actually need that supplement. But reach out to your healthcare team. Something easy that you can do to help with a magnesium deficiency is actually taking a bath with Epsom salt or having a foot soak with Epsom salt. That's a form of magnesium that your body can absorb through the skin, and that can help a little bit with deficiency.
Thank you. We have two questions regarding alcohol. What is the recommendations for a patient with bone marrow failure regarding alcohol? And the one is with somebody who has with low platelets. And then the second part of that question would be, what is a recommendation that how much wine per week is acceptable?
Okay, so this one is tough for me to answer because I feel like many hematologists sort of have their own advice on how much is safe for a patient to drink. And certainly some of that can be very dependent on the individual, what treatment they are receiving, what their liver enzymes look like. So generally speaking, the recommendation is less alcohol tends to be better for our health. And if alcohol is consumed, no more than 1 serving per day for women or 2 servings per day for men. And those recommendations can be found at the American Institute for Cancer Research website. some doctors I have found say that sticking with the guidelines of 2 per day for men, 1 per day for women are okay, and they're just okay with having all of their patients follow that. But I do work with some physicians who are a little bit more hesitant to have their patient drinking alcohol on a daily basis if they are actively on treatment. So again, it may be better to circle back to your physician, your nurse practitioner, physician assistant, and just see if they have any specific recommendations. Otherwise, it would be no more than 2 per day for men, 1 per day for women. And here at my cancer center, we don't have any specific recommendations dependent on the platelet counts. I'm not aware of any research that shows that alcohol can help or hinder platelet production. So we would just stick with the general guidelines for that.
Thank you so much. You had mentioned about the neutropenic diet for patients. Could you speak a little more about that, and specifically, why should raw vegetables be avoided?
Certainly. So our patients with bone marrow failure sometimes have a hard time producing enough white blood cells to really protect them from illness. And so if your absolute neutrophil count is quite low, you may need to follow a neutropenic diet. A neutropenic diet is just a diet that is really focused on food safety, allowing patients to enjoy foods that have very low risk of causing a foodborne illness, and really minimizing the intake of foods that are most likely to have bacteria. So our fresh fruits and vegetables are a little bit more likely to have bacteria on them. And on a neutropenic diet, they are often very much limited. When we cook them, it's safe because the nature of heating them has killed most of the bacteria, and now they're a little bit more safe. When a patient can't have those raw fruits and vegetables, you can certainly work with your dietitian to find other ways to get fruits and vegetables into your diet. So for example, every cancer center is a little bit different with what a neutropenic diet looks like for them. But here at my cancer center, we still allow fruits that have a very thick peel. So something like a banana or an orange, we will allow our patients to enjoy those fruits on a neutropenic diet as long as they are washed before the patient goes to peel them and consume it. Something that you can do to get even more fruits into your diet is purchase some canned fruits or frozen fruits, which are safe, and you can use those to make a smoothie or heat those up and add it to something like oatmeal or pancakes. And then for vegetables, we are pretty strict about the no salads, no raw cucumbers. So I just work with my patients on things like the frozen vegetables and how to incorporate those into their diet.
Thank you. Are there any natural foods that can help increase red blood counts?
So that is certainly a question we get very often. Unfortunately, the consensus seems to be that there really are, research has yet to identify particular foods that can really help with recovery of red blood cells, white blood cells, platelets. So I do wish I had some foods that I could recommend that I knew would help those counts recover, but we're just not aware of those yet. So in the meantime, though, I do always encourage my patients to try to eat enough calories and protein. I feel like generally speaking, if your diet is inadequate and you're a little bit malnourished, then you're just not giving the cells of your body the building blocks they need to create those cells. So definitely trying to take in enough nutrition, focus on high protein foods, which would be, for those of you who consume meat, poultry, fish, and seafood, those are high protein. Also beans, soy, tofu, nuts, those will give you some protein as well. And then it never hurts just to work on a variety of different foods in your diet, just to make sure, again, you're getting in all the building blocks you need to help with those red blood cells.
Thank you. You had mentioned about vegetables in like soups and stews. The question we have is, are vegetables in a stew still nutritious?
Oh, Absolutely. So this time of the year, I make a huge batch of soup every weekend and use that for my lunches. So when I had said before, if you boil, say I take some broccoli and I boil it in a pot of water, I am losing some of the nutrients in the water if I throw that down the drain. But when I am cooking and boiling a lot of vegetables in a pot and then consuming that broth is loaded with nutrients, minerals, all good stuff. So definitely continue to do your soups and stews.
Thank you. This question is, are there any restrictions to freezing fruits and vegetables? For example, bananas, blueberries, strawberries, watermelon, etc.
No, not really any restrictions. I would say just clean them before you begin the preparation process, especially if you are on a neutropenic diet. But that's certainly, it's perfect for health. So I know I very often buy berries and then I will freeze them to help them last longer and to use them in smoothies. And I certainly am always buying bananas to freeze for my smoothies. So I just peel them, break them up and put them in a Ziploc bag or a container and stick them in the freezer. And then they last quite a good period of time. So I definitely encourage that.
Thank you. This question comes from a patient who's mostly on a veggie diet. How do they make sure they're getting enough protein? And how do they get enough protein?
Yeah, sure. So it definitely, you have to be a little bit more mindful of thinking about protein, especially if you're new to a vegetarian or a vegan diet. Some of the great protein sources would be certain vegetarians still consume fish and seafood, so those are a great protein source. Another good one would be eggs. If you are vegetarian and you still eat eggs, that's a wonderful, complete source of protein. Beans are a phenomenal protein source. So when I had mentioned those blue zones earlier in the presentation, the parts of the world where people live the longest lives, one of their main sources of protein is beans. And in the blue zones, they tend to eat about 1 cup of beans per week. So beans are incredible. I would encourage all of you, if you're not eating beans on a regular basis, play around with them, experiment, and add that to your diet. That could be chickpeas on a salad, black beans in a soup, or hummus on a sandwich, or hummus with some veggies. So beans are a great protein source. So is soy and tofu and soy milk and edamame. That's a wonderful protein source. You could also do your nuts and your nut butter. So peanut butter, almond butter, a handful of pistachios. And then if you are having trouble eating enough protein, you could certainly play around with some protein powders and protein shakes.
We have quite a few questions regarding leftovers. How long are leftovers good to be able to eat? And what is the best way for storing leftovers?
Okay. I would say the USDA has a lot of good food safety information on their website. Knowing that this population with bone marrow failure can have a much weaker immune system, I would say it would certainly be good to consume leftovers within 3 days if it's been in your refrigerator. I think going any longer, there's a little bit more risk of bacteria really breeding in that food. But you can certainly, if you make a huge batch of food and you have more than 3 days worth, I would encourage you to break it up into smaller servings and store some of it in that freezer where it can last much longer without bacteria growing. But when it comes to the refrigerator, I would say 3 days would be my limit. And then I would say just making sure your refrigerator is at a cold temperature. So it should be below 40 degrees, and then refrigerating foods as soon as you're done preparing it. So stick it in that smaller container and get it right to the refrigerator.
Our next question is, let me scan down here. What foods are good for iron deficiency?
Sure. So iron deficiency, foods that are high in iron are primarily foods that come from an animal. That those foods would be beef, chicken and poultry, eggs, fish and seafood. So those are going to give your body a lot of iron, and iron found in animal foods tends to be a form of iron that our body can more easily absorb. You can also get iron from many plant foods. Beans and legumes are a good source of iron. So are some of your dark leafy greens like spinach, and beets as well give you a lot of iron. Iron found in those plant foods can be a little bit harder for our body to absorb and utilize. If you're still trying to improve your iron absorption, you can boost that by consuming a high vitamin C food every time you're eating a high iron food. So an example of that would be vitamin C is found in most of your fruits and vegetables. So if you are going to have a piece of chicken, have some broccoli with it, and the vitamin C in the broccoli is going to boost absorption. Many of your grains, so oatmeal, cereals, those can be fortified with iron. So it may not be found naturally, but it's added by the manufacturer. And then too much coffee and tea can inhibit absorption of iron. So that might be something to be mindful of as well.
Thank you. Are there any herbs that a person with a history of a blood disorder should watch out for?
Oh, so you certainly want to be mindful of supplements. I'm blanking on herbs offhand, but even just an example would be fish oil. Fish oil, in theory, has concerns about inhibiting the ability to clot your blood. So that's why if any of you have had surgeries or procedures, you're usually told to avoid herbs and fish oil supplements in the week before your surgery. I think that it's not something where I would make a blanket statement and say you cannot consume any herbs, but I would encourage you to talk with your healthcare team, whether that's you're just interested in herbs in general, or if you have a particular supplement that you're interested in taking. So a part of my job at my cancer center is when I meet with patients, if they are taking vitamins, herbal supplements, I make sure that I check it in a database to be sure that there's no interaction with their current therapy. And if that's something you're interested in, just reach out to your healthcare team and they can certainly look into that for you.
Thank you. This question is regarding red meat. My hematologist recommended I eat more red meat due to low iron levels. Does the recommendation of 12 ounces a week change for a patient with low iron levels?
Yeah, great question. So those recommendations I made in the beginning do tend to be just general recommendations, but every one of us is an individual and we may have specific needs. So I think if your provider, if your hematologist has encouraged you to focus on more red meat to help with your iron and your anemia, then I think you should certainly continue that. Again, general recommendations are one thing we make that apply to many people in the population. But just every day I'm meeting with someone, when I meet with my patients, I think of them as an individual and I try to tailor my recommendations to them. And I think that's exactly what your provider has done. So I would continue that.
What is the appropriate number of carbohydrates a diabetic can safely consume in a day?
In a day. So that's, again, everyone's a little bit different. And I tend to be very removed from diabetes where I work because we have diabetes specialists. So we usually send our patients to them. But I believe that the recommendation used to be about 30 grams of carbohydrate per meal. So then 3 meals a day would be about 90 grams. And then if you were someone who needed snacks, maybe to keep your weight up, to prevent weight loss, snacks were usually about 10 to 15 grams of carbohydrate. So I think for the average person, 100 grams of carbohydrate, but plus or minus a little bit depending on your individual needs.
Thank you. Are carbohydrates from fruits and vegetables counted differently than carbs from grains?
In the setting of diabetes, we usually count all carbohydrates equally. So fruits and vegetables, many of them do contain carbohydrate, and it doesn't make them bad. Carbohydrates are still good for us. But I believe in the setting of diabetes, we kind of include those the same way we would think about bread, rice, noodles, and pasta.
Thank you. For a patient who is not neutropenic, is there a general rule that it is okay for them to consume sushi or aged cheeses?
So I believe, again, every cancer center can view food safety a little bit differently. At my cancer center, anyone who is on active treatment, even if they are not neutropenic, we still encourage them to avoid raw fish, undercooked meats, and cheeses that have not been pasteurized. However, if we have someone who's more in the survivorship stage and we're just seeing them intermittently, but they're not on active treatment, they can certainly consume sushi and aged cheeses that have not been pasteurized. So that question probably depends on what your counts look like, if you are on treatment or not. So maybe circle back to your providers and ask them if that's okay. But if you were actively on treatment, if your counts were compromised, it would probably be a good idea to avoid the raw fish and maybe instead get like the California roll or just an avocado roll.
Thank you. This question comes from a patient who is currently taking cyclosporine. Prior to being on cyclosporine, they never had cholesterol issues. Now their cholesterol has skyrocketed. Is there a way to lower their cholesterol through diet, or is this just something that patients live with, and then once they come off the cyclosporine, their cholesterol level will get back to normal?
Yeah, that's a tough situation. I know that must be very frustrating to know that you've not done anything differently and now all of a sudden your cholesterol is much higher than it had been. I would say if you are really motivated to see if you can improve your cholesterol, then if you're not already following it, try to follow that plate method where about 75% of your plate consists of plant foods. So those plant foods, the fruits, veggies, beans, nuts, and seeds, they contain a lot of fiber, and fiber helps your body sort of pull cholesterol and get it out of your body. And then certainly be mindful of the amount of animal proteins you're eating, and be mindful about the amount of added sugar you are getting in your diet. So not sugar from fruit or potatoes, but rather any sweets, candy, sweetened beverages like the lemonade and the iced tea and the soda. If you can try that plate method and eat lots and lots of plant foods and really natural foods, and if your cholesterol doesn't budge, then unfortunately I feel like it is just a side effect of the medication. But sometimes following a really healthy diet can at least find a middle ground and improve things a little bit, even if it doesn't completely normalize it because of the medicine.
What is the best way to relieve or avoid constipation through diet?
Sure. So many of my patients experience constipation because of the medicines they're on, the treatment, or they just aren't able to be up and about and moving around as much as normal. So constipation is very, very common. Fiber and fluids are sort of the main things you can do to improve this. So certainly make sure you are drinking enough fluids. If you are dehydrated, then your stool is much more likely to be dry and hard and more difficult to pass. So improving hydration is going to ensure that it's a little bit softer and easier to pass. And truly, any fluid at room temperature is going to help to hydrate you. So if you're not someone who enjoys a lot of plain water, you could drink some hot tea, coffee. Coffee certainly has a laxative effect for many patients, even decaffeinated. So I would give that a try. So good hydration. And then fiber helps with constipation because it adds a little bit of bulk to the stool. So fiber is going to be found in any of your plant foods. So eating more fruits, vegetables, beans, nuts and seeds, and whole grains. And then some specific foods that can help with constipation in addition to coffee would be prunes and prune juice. Those have a laxative effect. And then kiwi is also great for constipation. So if you like kiwi, giving that a try. There is a tea called Smooth Move tea, and that contains senecot, which is a natural laxative. So you could also give that a try. Just be careful, watch how long you steep it, because the longer you steep that tea bag in the water, the more concentrated the senecot will be, which means it could be more likely to give you too much of a laxative effect or even cause a little bit of cramping.
Thank you. This question comes from an MDS patient. They would like to know, what do you suggest for a person on a low-fat, low-fiber diet? They feel that being on this diet pretty much kicks out all raw fruits, vegetables, and grains.
Yeah, that's a tough one. So, the low fiber, and I think I would also I wish I could know why you were on those restrictions so I could better figure out, is that something we can change with time? So sometimes when my patients are on a low fiber diet, they have trouble digesting foods when they're in more of a whole form. But if we cook those fiber foods or puree them, many of my patients can then tolerate those foods a little bit better. So an example of that would be having fruits, and maybe even fruits and vegetables, in a smoothie form where you are still getting the fiber, but it's really been pureed and broken down, and it's much easier on digestion. I also do the same with vegetables by having them cooked very well so that they're so soft and tender. And I often recommend soups and stews for my patients. So even with soups, we can prepare a soup with a lot of vegetables, but then even use an immersion blender and kind of really pulverize it and make it smooth and pureed, and that can improve digestion. My patients who have trouble with regular fiber, I often have them use a machine like a crock pot, a slow cooker, or an instant pot, because when we cook vegetables in those kitchen appliances, they just become so soft and tender, and that makes it easier to digest as well. So it of course depends on the circumstances, but many of my patients who don't do well with a lot of regular fiber foods do much better when it's been pureed. And then the low fat, again, it would help to know kind of why you're on that, but for some patients that means just avoiding anything deep fried or really greasy, but they can still have small amounts of a healthy fat, something like olive oil, a little bit of avocado, healthy fats like a fish or a tuna, and those tend to be safe for many individuals. And certainly send me an email if you want a little bit more guidance, and I could try to troubleshoot a little bit better for you.
Thank you so much, Joanna, for that. For patients who have no appetite, and or do you have some suggestions on how to increase appetite, or things that you can add to foods that give extra calories? So when a patient is able to eat, maybe they're getting a little more calories in what they're able to eat. Any suggestions for those patients?
Sure. So A poor appetite is absolutely very concerning. So usually at the cancer centers, the reason we check weight at every visit is because we want to be sure our patients are eating well. And if they are losing weight, if they do have a poor appetite, we want to intervene. There is so much research that shows that a stable weight and preventing weight loss and malnutrition can improve outcomes. It's associated with better survival, sometimes less side effects from the treatment, and of course, just allowing the patient to have the energy and the stamina to do the things that they like to do. So some of the general recommendations that would be good to start with. One is to focus on small, frequent meals. When you don't have a good appetite, if someone puts a big plate of food in front of you, that can even just psychologically make your appetite a little bit worse. So little portions, but doing that more often throughout the day. So instead of eating a breakfast, lunch, and dinner, maybe do a smaller breakfast, an hour or two later, have a snack or a protein shake. A little bit later, do your lunch. A little bit later, a snack or a protein shake, dinner, and then something little before bed. I had mentioned the protein shake. So I find that when someone has a very bad appetite, liquids can be a little bit easier to consume than food that they have to chew and sit there and really work hard on eating. So we very often recommend protein shakes at my cancer center. Most of you may be familiar with Boost and Ensure, and those are a great source of calories, protein, vitamins, and minerals. There are many, many others on the market. There's a great one if you are interested in organic ingredients called Orgain. So I often recommend that to my patients as well. So the protein shakes can be great. Making sure that when you do eat, you're really trying to maximize the nutrition in food. So focusing on high calorie, high protein foods like eggs, hard-boiled eggs, using more oils and butter in your cooking. So a little bit more olive oil, more butter on your toast, peanut butter, almond butter, really pack a punch with calories, avocado, guacamole, more hummus, just any way that you can really boost the nutrition in the food that you're eating. And then something else that works well for my patients is focusing on more soft foods. So much like the protein shakes, when you don't have a good appetite, the more you have to chew and work at eating, it just kind of can tire a patient out and make them not want to continue the meal. So I often brainstorm with my patients really soft foods that are easier for them to eat. And that could be oatmeal for breakfast, chicken salad or tuna salad with their lunch, maybe more of a casserole, or a very tender cut of fish with their dinner. So things that are crunchy and really tough to eat just sort of are harder for the patient to continue. And then if you are really struggling, certainly speak with your providers. Here at my cancer center, we often consider appetite medicines to help to boost their appetite and make you a little bit more hungry and have more of a desire to eat. So that can be something as simple as there's a common one we use that is actually an antidepressant, and it's just taken once a day at night before bed, but it can really help make someone more hungry. And depending on the state that you live in, there's also options like medical marijuana, which can certainly help appetite. So certainly discuss this issue with your providers, and even ask at your cancer center to meet with the dietitian who can help troubleshoot.
Is it safe for patients to eat unpasteurized honeys?
Yes, so that is a great question. So honey is absolutely safe on the neutropenic diet. We just want you to make sure there's nothing solid in your honey, that it's just a smooth honey. Honey not being pasteurized, the only issue is in, I believe, infants, maybe those under the age of 2 years old. There's a risk of botulism if honey is consumed. And under the age of 2, I believe our stomachs just are not acidic enough to kill any botulism. But once we're over that age, there's no reason to be concerned about that risk at all. So even on a neutropenic diet, honey is perfectly safe.
sorry, are there any particular diets that are safe for patients who may want to lose weight?
Sure, sure. So great question. So I would encourage you just to be mindful that you're not losing weight at the expense of under eating and sort of becoming a little bit malnourished. And this is again at your, at your doctor's office, asked to speak with a dietitian if they have one available. So very often when a patient would like to meet with me to help with a healthy weight loss, I actually start by going over the plate method, because I really find that by eating more of those plant foods, we are going to, our body will slowly make its way to a healthy weight and not at the expense of becoming malnourished. And specifically with the plate method, I have patients make half of their plate non-starchy vegetables. So things like their salad or their steamed broccoli, and then potatoes, bread, rice, starches are only about a quarter of the meal. And then the last quarter of the plate would be their protein source. So continuing that plate method, but really making the heart of the plate their low-calorie vegetables. And I think that that's a great way to achieve some gradual healthy weight loss. Otherwise, just the general Mediterranean diet is great for health. So those are usually what I recommend.
Thank you. This question comes from an MDS patient who has high potassium, high ferritin, high uric acid, but a low hemoglobin. Do you have any recommendations for foods that would help with lowering the high levels and possibly helping to increase the red blood cell count?
Okay. So I don't know, that is a tough one. The phosphorus can certainly be, foods that contain phosphorus would be dairy products. I believe peanut butter also has a lot of phosphorus, some of your nuts, and perhaps, I don't see high phosphorus too often, but I think even breads can be a high source of phosphorus, but I could be wrong. But depending on the reason why your phosphorus is high, you may not be able to fix that with diet alone. And the red blood cells, again, you can't necessarily improve that through diet. So just making sure within your restrictions that you're trying to eat that balanced diet. And you certainly have a little bit more tricky things ahead of you. So that's, again, I would reach out at the doctor's office and see if they have a dietitian available who can really look at your labs, see exactly what they are, talk with the team about why they're high and what the expectations with diet changes are, and then they can help you kind of figure out what to eat and not.
Thank you. This question goes back to about consuming undercooked meats. Would a medium or medium rare meat be okay as long as it meets the correct temperature requirements for that particular meat?
Sure. So I understand where you're coming from, because I also do not like a steak well done. So that would depend on what your counts look like and whether or not you are on treatment, and sort of the, again, every cancer center is a little bit different in terms of food safety. So I will say at my cancer center, if you are actively on treatment, technically I am supposed to say that the steak should be cooked well done all the way through. Even something like eggs are technically not supposed to be like an egg over easy. That yolk is supposed to be hard. But again, I would reach out, to your provider, because if you are not actively on treatment, if your counts are good, they may say that you're okay to do that. Like I know, again, if my patients are on chemotherapy, I'm supposed to tell them that that steak needs to be well done. Unfortunately, I'm sorry.
Thank you. Are there reasons for eliminating dairy products in your diet? And is that recommended to eliminate or lessen dairy products?
Yeah, great question. So in terms of the general guidelines for the average person, especially from a cancer standpoint, we feel like dairy consumed in moderation is perfectly safe. So the general guideline is 3 servings per day or less is perfectly safe. And a serving would be 8 ounces of milk, a container of yogurt, or 1 ounce of cheese. So if you're within those guidelines, perfectly safe. I feel like there is no reason to specifically imply that dairy is not okay for individuals as long as you digest it well and you're not having any issues. I do find that lactose intolerance, which is where when you consume dairy products, you maybe get gas, bloating, a bellyache, diarrhea. That can be very common as we get older. And certainly if your body is under stress because of your health issues. So if you can always kind of pay attention and be mindful of how you feel after dairy. If it is bothering your stomach, then you can try some of the many non-dairy options available these days. Otherwise, I think it's just a personal preference. If you like dairy, if you feel fine with it, if it's a good protein source, then you can continue to enjoy it. If you want to try the non-dairy options like the oat milk, almond milk, soy milk, give them a try. And if you notice any difference, if you feel better without dairy, then you can certainly continue that.
Thank you. If somebody was looking, Joanna, for a oncology dietitian, how would they go about finding one local in their area?
Great question. So I would first want you to check at your doctor's office and make sure there's not a dietitian available to you. So at many cancer centers, there may be a dietitian, but sometimes we really are just focusing on some of the patients who present with the most malnutrition. So I spend a lot of my day working with pancreatic cancer, esophageal cancer, head and neck, and very often the patients with bone marrow failure, I am only brought in if the doctor recognizes an issue or if the patient asks for me. So you absolutely may have a dietitian available for you, and you just may need to ask for a consult and your team can make that happen. Otherwise, I would encourage you to go to the Academy of Nutrition and Dietetics website. That is www.eatright.org. And there is a little section, find a dietitian, and you can enter your zip code and you can check a box for a dietitian who has been board certified in oncology nutrition, which just means they have more experience with oncology, hematology, and they kind of understand the disease process a little bit better. If you don't live local to any oncology dietitians and you can't find one to work virtually with you, the Leukemia and Lymphoma Society, I believe that they have a service available for free dietitian consults, so you could look into that as well.
Thank you so much. And with the holidays that are among us and everybody is eating with family and taking foods back and forth, do you have any suggestions on how to make sure, what you're eating or what you're taking to someone is remaining safe for everyone?
Yes. So I want you to enjoy that food and enjoy the holidays, but especially for those of you who have more of a compromised immune system, certainly be careful about food safety. So I wouldn't want you to eat any food that has been sitting out for a long time. So say you go to someone's house and they have a dip and vegetables out, but it's been sitting out for hours and hours. I definitely wouldn't want you consuming that dip. The same with the hot meals. Any of our patients on a neutropenic diet, we often say no buffets, no potlucks. There certainly is a very real risk of you catching a foodborne illness. So you want things to go kind of from the oven, from the stovetop to the table, and then you're going to consume it right there and there versus having it sit out for a long time. Definitely, if you're on the neutropenic diet, be really careful and cautious. But enjoy the food and enjoy the holidays.
Joanne, what is the lifetime that a food can sit out that remains safe? Like you were saying, like a dip or something like that, that typically has to be refrigerated. What is there is there like a standard time frame that it can sit out that it's safe?
Yeah, I mean, I feel like if you're on the neutropenic diet, definitely an hour or less. Maybe I would say 2 hours if you have bone marrow failure, but your white blood cells and your ANC is normal. You can get a little bit more time. I have a tummy of steel, so I push the limits all the time, but I want you guys to be extra careful. The last thing you want is a foodborne illness that sort of makes you feel really crummy, that heaven forbid could make you go to the emergency department or the hospital during these scary times. So I just want you to be extra careful. It's just not worth the risk, I think.
Thank you so much, Joanna, for sharing your time and your expertise with all of us today. If you'd like to watch this webinar again at a later time, it will be available within 2 to 3 business days, and you will receive an email when it is live and ready for viewing. If we were not able to get to your question today, or you have any additional questions, you can send it to us in 3 ways. Send an email to help@aamds.org. You can contact our helpline at 800-747-2820, extension 2, or submit your question on our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us today, making us your resource of choice for information on bone marrow failure diseases. On behalf of the Aplastic Anemia Foundation, we are always here to help you and your team, as we've done for the past 37 years. This concludes our program. Happy holidays, everyone. Thank you, Joanna.
Happy holidays.